Welcome to the first quarter 2025 Indiana FADS Education webinar on interactive complexity coverage. This webinar is designed to provide billing providers with guidance from the Indiana FSSA for coverage of interactive complexity. It will also offer comprehensive training on the documentation requirements for this type of service. The goal is to ensure that all Medicaid claims submissions are fully supported and properly documented. This webinar is being sponsored by the Office of Medicaid Policy and Planning, or OMPP, with contributions from Lisa Copsey and Kelsey Oren. By the end of this webinar, you should be able to review the IHCP rendering provider medical record documentation requirements, define interactive complexity, understand the IHCP billing and key documentation requirements for the add-on service, and describe common documentation errors and prevention methods. Let's start by reviewing the FSSA policies.
We will begin by reviewing the provider's responsibilities to ensure that the medical record documentation fully supports the claims billed for these services. As an IHCP provider, it's important to understand the connection between the Rendering Provider Agreement and Attestation Form and interactive complexity billing requirements. In particular, by signing the Rendering Provider Agreement and Attestation Form, you are confirming that you will accurately follow IHCP's billing rules. This includes adhering to specific guidelines for interactive complexity services, such as using the correct procedure codes, modifiers, and documentation. Accurate billing is essential to ensure that services are reimbursed correctly and in compliance with Medicaid standards. The form requires you to comply with Medicaid regulations and state and federal Medicaid guidelines, including the correct reporting of interactive complexity services. This means that when billing for interactive complexity services, you must provide detailed progress notes, treatment plans, and other supporting documentation to justify the claims. These practices are directly tied to your attestation that all claims will be submitted according to IHCP rules. The Rendering Provider Agreement stipulates that providers must maintain and submit accurate records, including the rationale for treatment and progress updates. This helps ensure that the services are medically necessary and align with the billing requirements. In summary, the Rendering Provider Agreement and Attestation Form is your formal commitment to comply with billing requirements and to uphold the integrity of interactive complexity services under IHCP. By signing the agreement, you're affirming that you will submit accurate and supported claims in line with both Medicaid and IHCP guidelines. Let's examine the agreement's terms related to medical records and documentation, and how they relate to the billing requirements for interactive complexity. In Section 11, providers agree to abide by the state's Medical Policy Manual and IHCP Provider Reference Modules as amended from time to time, as well as all provider bulletins, banner pages, and notices. Any amendments to the policy manual or reference modules, including provider bulletins, banner pages, and notices, will be communicated on the official state Medicaid website and will be binding when made public. Section 24 states that providers agree to fully cooperate with federal and state officials and their agents as they conduct periodic inspections, reviews, and audits. In Section 25, providers agree to make available records and information necessary to assure the appropriateness of IHCP payments made to providers. This assures the proper administration of the IHCP and assures the provider's compliance with all applicable statutes and regulations. These records and information are specified in 405 Indiana Administrative Code Sections 1 through 5, and in the policy manual, reference modules, bulletins, and banner pages. Section 25 also includes a list of the records that should be included, though this is not a complete list of records that may be required. Medical records, as specified by Title 42 U.S. Code Section 1396A, Number 27, and any amendments. Records of all treatments, drugs, and services that the vendor payments have been made for or are to be made under Title 19 or Title 21 programs, including the authority for and the date of administration of the treatments, drugs, or services. Any records determined by FSSA or its representative to be necessary to fully disclose and document the extent of services provided to individuals receiving assistance under the provisions of the IHCP. Documentation in each patient's record enables the FSSA or its agent to verify that each charge is due and proper. All other records found necessary by the FSSA or its agent in determining compliance with any federal or state law, rule, or regulation communicated by the United States Department of Health and Human Services or by the FSSA, and any other information regarding payments claimed by the provider for furnishing services to the plan. Now that we have reviewed the Rendering Provider Agreement, you may be asking, what can I do as a rendering provider to ensure I'm following these requirements? IHCP policies emphasize 4 key areas to ensure compliance with complete and accurate documentation. The OMPP Program Integrity section offers the following best practices based on findings and issues identified in previous audits as follows. Make sure that each patient encounter is documented completely, accurately, legibly, and timely. Make sure the documentation clearly identifies the rendering provider and/or rendering provider employees. Make sure the documentation is signed and dated. And make sure the documentation includes details of physician involvement. This documentation is crucial as it serves as a primary means of communicating essential patient information. Incomplete or inaccurate records can lead to unintended and potentially dangerous outcomes for patients. Also, precise documentation is vital for adhering to federal and state laws, and it plays a significant role in minimizing fraud, waste, and abuse. Providers can use the following links to visit the Provider References page for IHCP Provider Reference modules. For historical purposes, bulletins issued before 2020 are accessible from the archived bulletins.
In this section, we will provide a high-level overview of the Interactive Complexity Add-on service and requirements. The Interactive Complexity Add-on service addresses the unique communication challenges that can arise during psychotherapy sessions. The Interactive Complexity Add-on service is utilized alongside psychotherapy sessions when certain communication challenges occur between the practitioner and the patient, family members, or guardians, complicating the delivery of care. In January 2022, the American Psychological Association, or APA, revised its guidelines for the application and documentation of this code. Additionally, the IHCP banner BR 202323, dated June 6, 2023, specifies these complicating factors must be documented in the patient's record to justify the use of this code. Next, we'll discuss examples of communication difficulties. The specific communication challenges often arise with people who are having legal guardians or others responsible for their care, such as minors or adults with guardians, requesting the presence of others during their visit, like adults accompanied by family members, interpreters, or language translators, or needing the involvement of a third party, such as child welfare agencies, parole, probation officers, or schools. The guidelines discussed here are listed in the CMS Coding Guidelines. Let's discuss when interactive complexity can be reported. Interactive complexity can be reported with psychiatric procedures when at least one of the following communication challenges are present. The need to manage maladaptive communication among participants, such as high anxiety, high reactivity, repeated questions, or disagreements, which complicates the delivery of care. When a caregiver's emotions or behaviors interfere with the implementation of the treatment plan. Evidence or disclosure of a sentinel event requiring a mandated report to a third party, for example, reporting abuse or neglect to a state agency, This evidence or disclosure goes along with the initiation of a discussion about the event and/or report with the patient and other patients. The use of play equipment, physical devices, interpreters, or translators to overcome significant language barriers. For more information about reporting interactive complexity, visit the 2022 Guidelines article from APA.
IHCP and CMS have created billing guidelines to help providers understand the regulations associated with the interactive complexity add-on service. This section reviews these key regulations. When providing the interactive complexity service, the billing provider should use CPT code 90785. For time-based codes, the documentation must specify the duration spent on interactive complexity services. This code is used alongside other codes for diagnostic psychiatric evaluations using CPT codes 90791 or 92. Psychotherapy sessions using CPT codes 90832, 34, or 37. Psychotherapy combined with an E&M service using CPT codes 90833, 36, or 38, 99202 through 99255, 99304 through 99310, or 99341 through 99350. Group psychotherapy using CPT code 90853. Next, we will discuss some limitations to the specific billing requirements for CPT 90785. There are specific limitations in billing requirements for using CPT code 90785 as outlined by CMS and Local Coverage Determination or LCD guidance. The following should not be reported or billed if the need for translation or interpretation services is necessary, psychotherapy for crisis codes, or with E&M services, unless a psychotherapy services is also being reported, or a patient is unable to communicate by any means. Next, we will discuss different regulations and when they are used for interactive complexity services.
IHCP and CMS have created guidelines to help providers understand the regulations associated with interactive complexity. This section reviews these key regulations. Let's consider some key IHCP and CMS documentation requirements for interactive complexity services. Keep in mind that this is not an all-inclusive list of regulations. To learn more, visit the links here or the IHCP's website. Treatment plan requirements for interactive complexity can be found in the IHCP Provider Reference Module, Behavioral Health Services. When creating a treatment plan, the following should be included: the identification of the individual's behavioral, psychological, family, and medical concerns, and the age-appropriate measurable goals that includes baseline measurements and anticipated timelines for achievement. The plan should include the number of hours per week being requested, with justification and supporting documentation for the specific number of hours based on the individual's needs, such as considering the individual's age, school attendance requirements, and other daily activities. Ensure that the plan includes a clear schedule of services planned and documentation that all identified interventions are consistent. For any visit or treatment notes associated to interactive complexity, the IHCP provides guidance in the 405 IAC 1-1.4-2 Medical Records. Medicaid reimbursement is available for services rendered by an appropriate practitioner. Visit and therapy notes for services must include the following: the identity of the individual to whom service was rendered, the identity including the signature or initials of the provider rendering the service, the identity including dated signature or initials and position of the provider-employee rendering the service, the date on which the service was rendered, and a statement describing services rendered including the duration of services rendered, for example, the time in and time out. Refer to the IHCP Provider Reference Module, Provider and Member Utilization Review for documentation requirements. Let's look at interactive complexity billing documentation and retention. When using the add-on CPT code 90785, this table allows providers to pair the appropriate primary service codes. According to the IHCP Provider Reference Module on Provider and Member Utilization Review, medical records must include, at a minimum, the identity of the provider rendering the service, verified by a dated signature or initials. Per the IHCP Provider Reference Module and 405 IAC 1-1.4-2, all IHCP providers are required to maintain medical and other necessary records for a period of 7 years from the date that services are provided. These records must fully disclose and document the extent of the services rendered. Before submitting a claim, make sure that all of the documentation is correctly authenticated and maintained to ensure proper payment and adequate substantiation in the case of an audit.
The OMPP identifies common errors during the documentation for interactive complexity and examples to prevent potential errors in the future. In this section, we will look at the review process from the medical reviewer's perspective and present the common documentation and process errors that are detected. To ensure a smooth and efficient review process, please follow these instructions when preparing your documentation. By adhering to these guidelines, you can help expedite the review process and minimize any potential delays or denials. When gathering your documentation to submit to IHCP for review of medical records, please ensure that all documents are combined into a single PDF file for each requested member. Label each PDF using a consistent title for each member, including the audit case ID number and the member's name. Here is an example of how the PDF file should be named. To ensure a streamlined review process within the file, please ensure that the documents are submitted in this order. 1. Plan for treatment for the requested date of service with a dated signature from the supervising practitioner. 2. Prior authorization approval notice. 3. Comprehensive diagnostic evaluation. 4. Visit or therapy notes in order by date of service. 5. Other documentation needed to support the procedure code build. Note: if all of the required items are not submitted, the documents do not include a date or signature, or there is a discrepancy in the billing unit, the claim line will be fully denied. Any findings identified are preliminary. Until the final calculation of overpayment is determined, the provider will have the opportunity to respond to the audit and request reconsideration by submitting new or additional documentation. Now let's look at the common documentation and process errors. Let's take a look at an example of a minor under parental or guardian care that seems to have the components needed to submit documentation, but may be missing some important elements. For this session, the rendering provider included a billed psychotherapy code involving a minor under parental or guardian care and had a diagnosis that met the criteria. However, one of the following was not documented during the session. Managing maladaptive communication, indicating that a caregiver's emotions or behaviors interfered with understanding or implementing the treatment plan. Providing evidence or disclosure of a sentinel event requiring third-party reporting. Using play equipment or physical devices to overcome communication barriers. Or proceeding with a session without indicating an issue. Next, we will discuss common errors within documentation and processing. While conducting reviews, the medical record reviewers find some common errors that can be prevented. Some of these errors are documentation dates, specifically required documents that were missing the billed dates of service. Diagnostic evaluation, specifically not disclosing the document in support of the service or not completing a comprehensive diagnostic evaluation. Appropriate diagnosis that was not provided on the treatment plan. The treatment plan was missing from the submitted documentation. Signatures were missing on the treatment plan, rendering provider's visit or therapy notes. Patient identifiers were missing from one or more pages on the record. And billing units were not supported in the documentation.
Let's wrap up by reviewing some key takeaways about interactive complexity. In summary, there are several key takeaways. The interactive complexity service requires a written treatment plan or plan of care developed by a qualified practitioner or therapist and signed by the supervising practitioner. This plan must include the essential details previously outlined in the presentation. Interactive therapy in progress notes must contain the patient's identity, the dated signature and position of the rendering provider, and the services provided, including the time in and time out. When providing the interactive complexity service, the billing provider should use CPT code 90785. This code is used alongside those for diagnostic psychiatric evaluation, psychotherapy, psychotherapy performed with an E&M service, and group psychotherapy. Specific complicating factors must be thoroughly documented in the patient record to justify the use of this code. For more information on interactive complexity, services, and coverage, please refer to the references included in the PDF version of this presentation, which can be found on the Program Integrity website. The Program Integrity team has a provider education website where you can access additional training to stay up to date on the latest information. Thank you for attending this session. If you have any questions, please email the Program Integrity email address listed here.